Antidotes are substances that counteract the toxic effects of drugs or poisons. They work through mechanisms like receptor blockade, chelation, or metabolic antagonism. For opioid overdose from agents like heroin or fentanyl, the antidote is naloxone. It acts as a competitive mu-opioid receptor antagonist. Dosing includes 4 milligrams intranasally or zero point 0.4 to 2 milligrams intramuscularly or intravenously every 2 to 3 minutes as needed. Its short half-life may require redosing for long-acting opioids. In benzodiazepine overdose from drugs like diazepam, the antidote is flumazenil. It competitively antagonizes GABA-A receptors. Administer zero point 0.2 milligrams intravenously over 30 seconds, repeating every 1 to 2 minutes with a maximum of 3 milligrams per hour. Be cautious of seizure risk in mixed overdoses. For acetaminophen poisoning, use N-acetylcysteine. It replenishes glutathione to neutralize the toxic metabolite N-acetyl-P-benzoquinone, imine. The oral regimen is a loading dose of 140 milligrams per kilogram, followed by 70 milligrams per kilogram every 4 hours for 17 doses. Intravenous dosing is 150 milligrams per kilogram over 1 hour, then 50 milligrams per kilogram over 4 hours, and 100 milligrams per kilogram over 16 hours. It is most effective within 8 hours of ingestion. In iron poisoning, the antidote is deferoxamine. It chelates free iron for renal excretion. Give 15 milligrams per kilogram per hour intravenously, with a maximum of 6 grams in 24 hours. Watch for vomiting, diarrhea, and metabolic acidosis. For digoxin toxicity, use Digoxin Immune Fab. It binds digoxin to form inactive complexes. Dose 10 to 20 vials for acute overdose or 1 to 2 vials for chronic toxicity. Monitor calcium and potassium levels. In warfarin overdose, administer vitamin K and fresh frozen plasma. Vitamin K reverses clotting factor inhibition at 5 to 10 milligrams intravenously or orally, while fresh frozen plasma provides immediate factor replacement at 15 to 20 milliliters per kilogram for severe bleeding. For beta blocker overdose, Glucagon is the antidote. It increases cardiac contractility by bypassing beta receptors. Give 3 to 10 milligrams intravenous bolus, followed by an infusion of 1 to 5 milligrams per hour. In calcium channel blocker overdose, use calcium gluconate or calcium chloride. It increases extracellular calcium to overcome blockade. Dose 1 to 3 grams of calcium gluconate intravenously or 1 gram of calcium chloride for hypotension. For heparin overdose, protamine sulfate is the antidote. It binds heparin to form inactive complexes. Administer 1 milligram per 100 units of heparin with a maximum of 50 milligrams per dose via slow intravenous infusion. In methanol or ethylene glycol poisoning, use fomepizole or ethanol. They inhibit alcohol dehydrogenase. Fomepizole is dosed at 15 milligrams per kilogram intravenously, then 10 milligrams per kilogram every 12 hours. Ethanol is given as a loading dose of 10 milliliters per kilogram of a 10% solution, then 1 to 2 milliliters per kilogram per hour. For cyanide poisoning, the cyanide antidote kit is used. Sodium nitrite induces methemoglobin at 300 milligrams intravenously over 5 to 10 minutes, and sodium thiosulfate converts cyanide to thiocyanate at 12.5 grams intravenously. In organophosphate or carbamate poisoning, administer atropine and pralidoxime. Atropine blocks muscarinic receptors at 2 to 5 milligrams intravenously every 5 to 10 minutes until secretions dry. Pralidoxime reactivates acetylcholinesterase at 1 to 2 grams intravenously over 30 minutes. If you found this video helpful, don't forget to like, share, and subscribe for more informative content. Stay tuned for our next video.